My name's Tiffany Thompson. I'm the Administrative Director of Nursing here at Soin Medical Center, and I have responsibility over the medical surgical units, house supervision, and staffing. So this is our teletracking board for this unit specifically, and as you can see, it's a comprehensive view of our patient census and gives us a lot of information in a very quick view so that the team can stay on task with expediting those patients out of here, removing barriers for them, identifying our patients in OBS. It even has nursing assistant and nursing assignment, which is really awesome, and then who the attending physicians are for those patients. One of the things that I love the most about this is the observation timer. This is very important because oftentimes, especially when we have numerous physicians seeing a patient, they may not realize the patient's still in observation status. So having this view here to show how many hours over that they are helps the manager and the charge nurse facilitate those conversations with the physician to say, you know, what are we doing with this patient? Is this patient truly appropriate for an inpatient bed, or should we discharge them? And if they're appropriate, then we identify that criteria and change their status. So it's a win for the hospital and the patient. Our in-care coordinators and social services teams are really utilizing the Milestone function, which is fantastic because they're able to put in there if we're pending a pre-cert for an ECF, if we need additional consults from physicians prior to discharge. And then the Milestone Tracker tracks the progress, so we can see how close the patients are to discharge. And so the charge nurses or the nurse manager can look at that daily, see what we're waiting on, and then prioritize activities for those patients to expedite their discharge. And prior to that, other than going through the nursing notes or the physician notes, we may not have seen that. So that's a very, very nice feature. We can see our pending discharges. Those patients that we think will go within 24 hours then are identified with a small d on the board. So this helps our night shift nursing team come in and see that they have a patient likely to go home tomorrow, so they can begin that discharge process in the evening hours. So that in the morning, when the day shift charge nurse comes on and we have the physician huddle in the morning and we identify that patient to go home that day, then all of those pieces are already in place and it expedites the discharge for the day shift nurse. The supervisors and the personnel and managers at the NOC have built a really nice collaborative partnership and relationship. So when there are questions or concerns about patient placement or appropriateness of a patient, the supervisors feel very free to just pick up the phone, call the NOC, and then work through that process together.